Pfizer says its data shows that the effectiveness of its vaccine drops by 6% every 2 months after the second dose, not because of the Delta variant, but because of the vaccine's efficacy. It's one reason why medical experts say that so-called breakthrough cases are happening across the country among those fully vaccinated.
What we've seen is increases in cases and breakthrough cases as time goes on. That's not directly related to Delta, but just because of a waning immunity. And this is why this booster question is coming into play right now.
Pfizer now recommending that folks 16 years and older get a booster shot 6 months after getting the second dose.
Big picture, boosting is important, boosting is necessary.
The FDA meets on Friday to review Pfizer's clinical trials and other research to determine whether there's enough data to recommend that Americans need that extra shot in the arm at this time.
There's no medical downside because the safety profiles of these vaccines are incredibly good. At the same time, we want to wait for the FDA and then CDC to really learn the best timing and dosage that they recommend.
Meanwhile, Moderna releasing their own studies also showing breakthrough cases among those fully vaccinated a year ago versus those who recently got the jab. Moderna's president is also making the case for booster vaccines, though he says their inoculation appears to be strongest among the 3 vaccines against the Delta variant.
It's not the kind of thing that you want to miss by 6 months. You'd rather be a little too early than a little too late because ultimately lives are at stake.
Unlike Pfizer, Moderna is asking the FDA to allow its boosters to be a 50 microgram dose, half the dosage of the first 2 shots. A month after the Biden administration recommended that adults who got either Pfizer or Moderna start getting boosters this month, there's been a debate on whether there's sufficient data to warrant an extra shot. Health experts from around the world, including 2 FDA vaccine leaders, wrote in the Lancet Medical Journal this week that vaccine boosters are not necessary right now based on the current data, and pushed back against White House plans to roll out booster shots for everyone. George Thomas, CBN News.